Good morning, everyone, and thank you for joining us. My name is Sean Horrigan. I'm a Marketing Communications Associate at Commonwealth Purchasing Group. For those of you that are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. We are very excited to have Dan Zaccardi, Senior Sales Director, and Brenda Hall, Operations Manager for Release of Information from GRM on our webinar on Streamlining the Release of Medical Records, a Guide for Community Health Centers. GRM Document Management is the premier provider of records and information management solutions worldwide, with over 30 years of experience managing patient data within the healthcare center arena. Today's webinar is designed to last for 1 hour, allotting 30 minutes for the presentation portion and 30 minutes for the Q&A. As you can see, your line is currently muted. When we reach the Q&A portion of our webinar, you may type your question into the question box located on your control panel, or if you'd like to ask a question over the line, please use the raise your hand option, which is also located on the control panel, which will allow us to unmute your line so you can ask your question directly to Brenda and Dan. At this time, I'd like to hand it over to Dan. Dan, thanks for joining us, and why don't we get started?
Great, thank you, Sean. Good morning, everyone. Thanks for joining us here. My name is Dan Zaccardi, as Sean said. I am a Senior Sales Director here at GRM Information Management. I'm based out of Boston, where Commonwealth Purchasing is also based out of, and over the past year plus, been the liaison between GRM and Commonwealth Purchasing Group. I've been concentrating on member reach out, kind of introducing GRM's healthcare platform to all these CPG members, chatting with various records and information management services. Been at this for quite a while now, going on 12 years in the industry, 12 years working with healthcare, and with records and information management solutions. So a lot of experience I'm bringing to the table. Hopefully I get a chance to talk with all of you individually at some point in the near future and talk more about the solution set we bring to the table, including a lot of what we're talking about today with release of information. Also on the line from GRM is Brenda Hall. Brenda has been heading up our release of information division here at GRM for going on 13 years, has over 20 years experience in the healthcare space, brings a wealth of knowledge to the release of information process, and also the knowledge that is required for compliance with all the state, federal, HIPAA regulations, and all the protection of PHI, which is so important, which we'll cover further in this presentation today. So, like I said, thank you for your time. We can go over a quick agenda of what we'll cover in this session. Obviously, just a quick review of what is release of information, or ROI. With all these acronyms, I always like to point out what these acronyms are standing for, so we're all on the same page. Really, the focus of this session is what are why is it tough to manage this process internally, especially when we're talking about community health centers and FQHCs. Why is this such a pain point for all of these community health centers out there? We go through the main pain points, and then some ideas of how to streamline this process, and with that, an introduction to GRM's release of information solution, the division of our organization that Brenda Hall heads up. And with that, I'll go ahead, turn it over to Brenda, who, like I said, has a wealth of knowledge in this area, has been doing this a long time, and she brings a lot of value to the table. So Brenda, I'll hand it over to you there.
All right, thank you, Dan. Good morning, everyone. Thank you for joining us. We're going to start with what is release of information. And as Dan said, there are so many acronyms associated with the medical field that sometimes what we believe the initials stand for are not exactly what they are. So if I go back and forth with an acronym and then go back to the true meaning of that, that's the reason. So release of information, that is when someone requests a portion of their medical record, either for another healthcare provider or for someone outside of that organization. And there are different types of requesters. You can have your patient requests, and the patients are going to be requesting their records for personal use. Maybe they're moving and want to take their records with them, or they're changing doctors. Your attorneys, accidents, litigation, there's numerous reasons why attorneys will request records. Insurance companies, if you're applying for health insurance or life insurance, they're going to want specific things out of a medical record to make sure that you are insurable. Legal requests, and we'll hit on these throughout the presentation as well, but on legal requests, again, it is kind of with the attorneys. The only difference is on the legal requests, if it comes to you as a subpoena, that's not necessarily an approved authorization. It's not HIPAA compliant. So you need to then go ask for a court order or a broad authorization. Your external audits, those are your HEDIS audits, and your medical record review audits. Those are necessary to do for your standing with the medical community. You need to be able to pass the audits. You need to make sure that what the health insurance is paying actually matches up with the service that has been provided by the patient. And the external audits are coming more and more, and the farther we get into the EHR systems, the more these will be in depth. It is a way for the government to make sure that everything matches up and we're not having a lot of Medicare, Medicaid fraud. Your government entities, your Social Security, disability, our law enforcement, we have a lot of, across the country, a lot of people that are detained currently in jails and in prisons. They need their medical records as well, so those are requested through release of information. How did we get here? Okay, this is quite the beginning of everything for medical records and release of information. Life before HIPAA. Well, we know that there were very few safeguards. You could request your medical record. Anyone could request your medical record, another doctor, an insurance company, and the office staff at your practice would turn over the records. There was no accountability. There were no safeguards. It was lawless at that point. And it was just done out of not having the knowledge, not knowing that what they were releasing was important and should have been protected. And in 1996, a law came, HIPAA, and the rules that they've put in place as they change constantly. Every year they come out with something else or they revise what they've had. Your authorization requirements. So now everyone that requests medical records must fill out a HIPAA-compliant authorization form. That's going to assure that the patient has approved that their records can be released, specifically what can be released in those records. And it also gives you accounting of disclosure. So each medical facility, small or large, with HIPAA, and if you're following the guidelines correctly, you will know who has touched that medical record, what's been released, who it's been released to. And those are things that if you go through an audit or you have a breach, you are required to be able to give the information to the office. Okay. Internal ROI process management. Why can it be tough to manage? When you have patients requesting medical records, and it generally starts with the patient requesting it because they're the ones that have to sign for sign the authorization to release their records. The patients are going to walk in and just ask for a copy of their records or their last visit. They may call on the telephone. They can email you. They're going to send that form in through USPS, through the post office. They could fax it in. And a lot of the patient portals at the hospitals and the clinics now have the option to fill out a release on that patient portal. And the difficult part for release of information is when patient portals became popular and the patient would hear, my medical record will be on that portal. I will no longer have to request my records or talk to the doctor. I can go in and read everything on there. That isn't actually how that worked, and I think as we're moving along, patients are being educated more on that. So it's very difficult for some of them to still see that what they're getting on the patient portal are lab results, just basic information, not the entire record. But as I said, as time goes on, they're getting more educated, and we're hoping to alleviate the frustration they have with the patient portals. But requests are coming in from various different avenues, which makes it difficult for any staff to be able to handle that. Your internal ROI process management, this is where are your medical records located? If you're a new facility, you might have the latest and the greatest EHR system. It's the only one you have, and gung-ho on any paper charts you've got, you've scanned those in there. You are one in a million. There are very few like that. Most practices, as I said, large or small, and a lot of the community health centers that we have, they'll have 2 EHR systems plus paper charts. So they're storing them in various different places. It could be in the off-site storage facility, which is a self-storage facility down the street. Bob's, drive in through the gate, raise your garage door, and put your medical records in there. It's a little bit of an issue, one, because it's not climate controlled and paper does absorb moisture, but also it's not compliant as far as security. There's no tracking of what's in there. Then you have your, as I said, your various legacy EHRs as well as your active EHR. If you're lucky enough to have the extra room on site and you store those records yourself, that's quite a task, and that's extra personnel. If you do an off-site storage vendor, you can be guaranteed, as long as you're choosing a reputable vendor, that those records are itemized. They know exactly what record is in what box, what shelf, what aisle, what floor, and you are completely compliant. At any time, you can say, Joe Smith's records are located here if you are asked to produce those. So your off-site storage vendor is actually the easiest and most compliant way to go. Again, it comes with a cost, and I know budget is always an issue. Regulatory compliance. Well, we all know that, again, we have to be HIPAA compliant. We have to have state and federal guidelines that we follow. Then we have to decide and make sure that we're following them correctly when on the rare occasion that state regulations do trump federal guidelines. There are some instances there. Your minimum necessary, you want to make sure that when you're doing release of information, you never stay in that minimum necessary field for too long. I don't find that it's a good place to be. If you know anything at all about HIPAA, you know that there is a gray area. And in that gray area, you can dance around there for a bit, and as long as you're doing it with the best intent and with no knowledge that it is incorrect, you are probably safe. For me and my departments, I choose not to try to play it safe in that gray area, because there's always the instance that something has changed you're not aware of, and then that's when a breach or an incident will occur. So the minimum necessary is not a good place to stay. All right, the main points on release of information. And this kind of comes into play with the staffing again, as well as the budgets. You have to have enough staff that are trained sufficiently, that continue their education. So you'll have a staff member who could be answering the phone, could be scheduling appointments, could be checking a patient out, who is also trying to do release of information. It's almost impossible to have that person continue their training and to do their job correctly if they're wearing that many hats, if they're doing all of those jobs. And I think everyone can agree that your staff, as well as all of the providers, the main objective is to make sure that the patients are getting the best care possible, and leave your facility, leave your clinic wanting to come back or suggesting, or referring their friends or family to you as well. So staffing takes up a tremendous amount of time for release of information. Potential liability associated with fulfilling ROI requests. Again, we have your state and federal regulatory guidelines surrounding PHI, so they have to know what personal health information can be released. If you release something that should not be, or if that authorization did not give you permission to release, again, you're opening yourself up for an incident or a breach, the difference being the level of the amount of people that could potentially have viewed that patient's information. And with that comes the different levels of fines. Your fines can start out at $10,000 for one incident or one breach because it was contained. It can go up to $3.2 million and above. There, in Dallas, the Children's Medical Center was fined $3.2 million because someone's BlackBerry, who had 3,800 patient record information on their personal information, that BlackBerry was not password protected, was not encrypted, and it was lost. So they got hit with a $3.2 million fine. Your public relation impact with that, any type of bad news travels faster than good. With your breaches, with your incidents, those are public knowledge. Those are out there in any site that you would choose to Google, as well as the OCR office. It will post all of these, and you can read the stories. So the bad press, it has a very negative attitude on your patient care. It's very hard to earn the trust back once that information has been made public. And then as far as the mental health, drug treatment, and alcohol treatment, again, on quite a few of our community health providers that we service, they have the clinics that have so many different specialties inside. Each authorization should be different. There should be a specific authorization for mental health. The drug treatment and alcohol and mental health can be on one broad auth, but you want to be very careful specifically with the mental health that you know what you can release. You don't want to release information that could do harm to the patient or anyone surrounding the patient. So there are different areas that the training is essential that anyone fulfilling this request has and understands. It's one thing to have the training, it's something completely different to understand word for word what you can and cannot do. There's no oops factor in medical records. You can't just unfortunately release a little something and it not be a bad thing. It's 100% correct, or it's not correct at all. There's no room for error. All right, the high costs associated with fulfilling ROI requests. Basically, you need additional staff to do this. If you're going to have someone that is designated just to do release of information, and it is a full-time job, you're going to be paying that staff member to only process requests and hopefully collect the payments. That's the difficult part. Most people don't feel that they need to pay for their medical records because it's their information. Most attorneys feel they shouldn't have to pay for the records until they win the case, and if they don't win the case, then why should they pay for them? My suggestion to anyone doing this on their own is make sure that you do your requests, but do those as prepayment. If you do not receive the payment, then you do not have to release the records. And there are some very fine rules and regulations you have to follow to be able to adhere to that. Your additional space that you're taking up for the ROI Fulfillment Center, or just a person in an exam room at a desk trying to do ROIs. You can repurpose that exam room and make it truly what it was, as an exam room, and generate additional revenue. You could also take that person that is doing the release of information and promote them within the company for another support role. The non-collection of ROI fees, as I said before, it's very difficult to collect fees for any medical record request once you have released it. Again, it's a product, but it's a service, and if you've already performed it, they don't see that there is any reason why they should actually pay you. Your potential fines, depending upon the knowledge and the speed of which the request gets out, is opening up fines for you. California, we have 15 days to process a request once we receive it. Other states, they're 30. Others, they might be a little bit longer. But then again, it depends upon the state, the type of practice. So that is, again, where the knowledge comes in and the training for your staff. Your painful points for community health centers and your FQHCs, it really comes down to the bottom line. You don't have the big hospital budgets to help alleviate the pain. You're short-staffed. If you're not short-staffed, you're certainly not overstaffed. There's very, very few of any of our clients that we have with this organization that has staff members sitting around doing nothing. Again, they're checking patients in, they're filing insurance claims, they're trying to do ROI, they're trying to answer the phone. It's just, they're overtasked, and when that occurs, there's a greater chance for error. When the error occurs, that becomes, again, hitting you where you don't have the budget already, hitting you with the large fines. So, our big push for our clients currently that we have with the CHC and the FQHCs is we've taken all of this pressure off of them. We've taken the expense off of them. If you can work with a partner for ROI that charges you a zero fee, and they've taken all of this off of your shoulder, then the money that you have allotted for ROI, you can put somewhere else that is more beneficial to the patient, to your practice, and to your facility. How can the process be streamlined? Partner with an ROI service provider. When you do that, and I will speak specifically in my experience for our company, for GRM, we remove all the steps from the health center. We receive all the phone calls, we receive all of the mail, we receive the requests however they come in. We make sure that that request is correct, that it is completely compliant down to the patient's signature, comparing it with the EMR system or the paper chart. If it is not a broad authorization and there is mental health, alcohol, substance abuse, HIV, those types of things, we will go in and redact that, meaning in our program, it will look up the words, it blocks that out, it puts redacted on it, so when you receive the record, it shows that there was something there that was redacted. We send out the invoices, we collect the payment, we do all the status updates, and then we deliver it. In our system, we let everyone log into it. There are no hidden components. You see what we're doing. You see what the process is through the entire way. We are 100% open. We will customize the workflow for your facility, for your clinic, for your practice, for your small hospital, to what works best for you. We are not an out-of-the-box kind of organization. We will work with you and make it the best solution for you. If you have various different EHR systems and you have paper. We log into EHR systems across the country. Some of our providers have 7, and then they also have paper charts. When you're processing a request, it could encompass all of those. What we do is we take all of the information necessary to fulfill that, we marry it together, we make sure that everything is compliant, that everything matches what it should, and then we continue processing it, and we send it out. You know, I can say that in my years here, and I was the start of the Release of Information program for GRM, we have not had, and I should knock on wood and maybe not say this out loud, but we have not had a major reportable breach since we have started doing this. Again, I believe that we are human and there are errors that can be made, but you have to have the check and balance in place to make sure that it is caught before it leaves our facility. And if it leaves our facility, then make sure it is taken care of immediately to where it does not become a breach. Our job is to make sure that we are protecting the patient's information, and your doctors and your facilities. GRM has 30 years of experience with managing patient data within the healthcare arena, and that encompasses all of the services that we offer. For release of information, we process requests quickly and accurately. We make sure that we're HIPAA, high-tech, and federal and state regulations compliant. Again, there's no option. You have to be, and if you are not, you should not be in this business. I make sure that there are safeguards in place to ensure that we keep the patient data and make sure that each one of my staff members realizes that the person that they're dealing with, the data that they're dealing with belongs to a person. And a lot of the times they will speak to the patient themselves. So that patient has a name, so they know who is accessing their records. And if they have questions, they can be educated. We can make sure that they understand the process and what we're doing. It is not an 800 call center number. You call us, we will talk to you. We receive phone calls every day for providers that we don't even service, but we will take the time to try to help the patient to make sure they understand what they should do when they call whomever the provider is currently using. For ROI, you know, there is 20+ years in my department. I have some staff members that have been doing this for 20 years, some that have only been doing it for 5. The nice thing is, when you add all of that together, the information, the education, the knowledge that each one of them brings to the table is just astronomical. You could not imagine the amount of experience that this department has and requires, and every partner or every provider or vendor that you use for ROI should be able to give you that. We work with healthcare providers of all types and sizes. You know, we work with the two physicians in a private practice that are still having paper, to, you know, your large hospitals. You know, our niche certainly is the clinics, the facilities that are more patient care oriented, as opposed to let's see 20 patients in an hour and see if we can make more money. We currently work with the community health centers and FQHCs across the country, and are more than happy to give anyone any references that you would like from any of our providers that we use, that we have permission to use. And that's something that Dan could possibly talk about later after the meeting if anyone would like to contact him. And we're ready for the question and answers part of the session. If you have any questions for me specifically, or something that Dan could help with, just please let us know, and thank you for your time.
Thank you so much, Brenda. That was really terrific, and thank you as well, Dan. We do have some questions that are coming in already. This is the time for you to pose your questions. You can either send them in just type them into the Q&A section or raise your hand. The first question is from Ellie. Are the slides available? Yes, Ellie, we will be sending you a recording of the webinar along with the slides. And Ellie also asked Brenda, would love to hear about responding to subpoenas that I guess vary by state. I'm in Louisiana.
All right, so on your subpoenas, when you receive a subpoena for medical records, that really is more a request. They're just asking for the records. It's not compliant. On any subpoena, the patient has not signed it. Most of the time they have not given permission. The subpoena is usually coming from the opposing party, and before you can release those records, and every jurisdiction is going to have a judge that handles court orders and subpoenas very quickly. So what that judge will do is he will review the subpoena, he will sign a court order, and once you receive a court order with the judge's signature, it can't be the attorney's, it can't be a legal clerk, it has to be a judge. So when that sitting judge signs that court order, that gives you permission to release the medical records of that patient, even without the patient's permission. What you will get a lot of pushback is from the attorney sending you the subpoena is that the subpoena is a legal document, and they're correct, it is, but it's not a legal document as far as being HIPAA compliant, and with your state and federal guidelines, you need to have that court order as well.
Great, thank you so much. It looks like Ellie has a question she wants to ask you verbally, so I'm going to unmute her line. Oh, no,
okay.
I think we answered her question there, so
all right.
She had raised her hand. Okay, next question. I work for an FQHC that has 11 clinics in 9 different locations. Is it possible to cover that wide span of an organization? I would love to hear more in regards to the cost of services.
Okay, so you have 11 clinics and 9 locations. That's not a problem at all. We've got several that that are that size and larger as well as smaller. And you centralize it. You know, as any vendor or partner, what they will do, and us specifically, is all of your requests, all of your authorizations would go to one location. I would guess that you have an EHR system, so they would all be put into there. Those requests then are accessed by my staff in your EMR system, and we process out of that. So it's not a location by location at that point. It becomes one group. If you have paper charts, you know, the same thing goes for that. The paper charts, if you have to have them at your facility, then we work to have one of our staff members come to your facility to scan those, or you could scan those yourself to us and put it into the EMR. Again, that's what I was talking about when I said there are different workflows and different things that we can do for each scenario, that nothing is out of the box. We're going to work with you to make it efficient, and you know, not only efficient but effortless. We want to make sure that the patients calling don't realize necessarily that you're leaving your facility if they're calling, and that's why we like to have the phone transferred directly to my department, and my staff answers it as medical records, and during that conversation we can ascertain what practice they're calling from when we find out what doctor they're requesting the records from. So it makes the transition easier, they feel safer. And as far as the no fee, you know, we like to look at your billable versus your non-billable. You know, if you have what the amounts are, your legal requests, your insurance requests, that type of thing. And that's something that once you break all of that down, you have a better knowledge of if there were to be a cost to you, or what is going to be divided and who's going to keep what aspect of that program.
Terrific. Next question comes from Shakira. What is the cost of your service?
Okay, Shakira, again, there's not a cost to our service for release of information specifically. We take on your phone calls, we take on the billing, we take on everything pertaining to release of information without a cost to you. Now, again, there are exceptions to everything, and we would have to look at what kind of requests you're getting in. Again, the billable versus non-billable, and that's meaning billable means if we can charge someone and receive payment for it, or non-billable meaning that it is a no charge. For us, we personally just automatically do first responders, and the military is non-billable, and that's on us. We don't count that against the provider as far as a non-billable. But we would have to specifically look at what types of requests you get. But our goal is always to make sure that the providers do not pay for this service, or if they do, it is a minimal fee. And honestly, I have not had any provider at this point that we have ever had them pay anything other than your basic non-billable postage. So if we're mailing out requests and we're not being paid for that request, we might bill back the provider for that postage. Again, but those are specifics that depends upon the program that we put together for you.
Our next question comes from Devon. Devon asks, is there any software that can black out any information on the medical record to prevent doing it by hand?
Yes, there is. A lot of your EHR systems have that built into it. If you have an older EHR, of course, that won't work. If you have the capability to export or download the document out of your EHR and put it into Adobe, the Adobe Pro has a wonderful redaction tool. And that's probably the easiest to use because most EHRs will let you export or download into a PDF format.
Great. Next question, actually it's two questions from Scott. First question is, do you use our organization's name when answering calls? And second question from Scott is, do you have references you can share in regards to your services?
All right, Scott, this is up to the organization themselves, the provider. We can answer it as your name, and we can give you a designated line. So any calls coming into that line would only be for you. In general, that go to our general phone line, we just answer it as medical records, and that way it's generic enough to where it doesn't specify GRM, it doesn't specify a provider, but the caller does hear medical records. So, we can work it either way.
And Scott's second question was, do you have references you can share in regards to your services?
And yes, I'm sorry, we definitely do. They can be inside the Community Health Center or FQHC organization, or it can be outside as well.
Terrific. If there are any more questions, please type them in at this time.
While there's a little bit of silence here, I'll jump in. This is Dan at GRM, and I just want everybody to be very clear, and I think Brenda did a really good job explaining this, that these programs are really customized to the individual health center, and there's a lot of questions about the cost of this service, and typically there is no cost to the provider. That's very important to realize that. How GRM or most, no, I won't say all, but most ROI providers, how they make any revenue is from the requester themselves. So we're billing before we release these records. We're not billing back the provider for anything, assuming we're getting a ratio of 1-to-1 for billable to non-billable. So there's this should be a no-cost solution for these health centers, which obviously goes over well within the FQHCs and community health center arenas.
Great. It looks like we don't have any more questions at this time. Brenda and Dan, thank you so much. It was a really terrific webinar with lots of great questions from our audience. Thank you for joining us today.
Thank you, everybody. Thank you, Sean.
Thank you so much. And again, we will be emailing you a recording of this webinar along with the PowerPoint presentation and the slides. Thanks so much.